Good afternoon, everyone, and welcome to Let's Talk About Health. Today marks the second in our new monthly community health conversation series on important health issues. I'm Donna Jacobs, Senior Vice President at the University of Maryland Medical System, and your moderator today. At the University of Maryland Medical System, we believe in heightening awareness about important health issues, creating an environment to make patient communication with healthcare providers easier and more impactful, and in providing people with the tools they need to help them maintain or improve their health. Our goal is to provide essential health information in this series to our community members in a clear, digestible, and informative way. To that end, we'll conduct a community health conversation in this webinar format every month. We've selected the noon hour for these community conversations in order that everyone may have an opportunity to join in the discussion at lunchtime, even after the COVID pandemic has ended and when more people are back at work. Today, we're talking about accessing health care and effective communication with healthcare providers. Leading our conversation today is Mandy Bounds, Project Manager of Organizational Excellence at the University of Maryland Shore Regional Health on the Eastern Shore. Shore Regional Health is comprised of three of the University of Maryland Medical System's 13 hospitals across the state. Mandy is an experienced registered nurse with expertise in critical care and acute care settings. She has served as the nurse leader and educator with both management and administrative roles. Mandy is currently an adjunct faculty member in Wilmington University's nursing program, and indeed, she herself is nearing the end of her doctoral nursing studies. Importantly, for today's conversation, for the past year, Ms. Bounds has focused on improving the process for discharging patients from the hospital and improving patient understanding and knowledge of their health care status. Her experiences, knowledge base, and focus make her the perfect person to start today's conversation. As the webinar proceeds, please feel free to use the question and answer box, the Q&A box, to type in questions that you may have. Our presenter will be happy to answer as many questions as we can in the time allotted. We'll also be able to answer any questions that we don't get to, should that happen, at a later point. And with that, Mandy.
Thanks, Donna, for the excellent introduction. I appreciate it. I want to thank the University of Maryland Medical System for this opportunity and for you for taking the time to listen in today to this community conversation. So happy lunch hour. Today we're going to be talking about taking charge of your health. And I'm going to share with you some very simple, important questions that you can ask when you have conversations at the office or on the phone with your healthcare provider. And I'm excited to have the opportunity to talk to you about this. In my experience as a nurse and working with the healthcare team, we use a variety of communication approaches and techniques to try to make sure that you understand what we're educating you about or asking you to do. For example, if I'm sitting at the bedside with you talking to you about a new medication, or your doctor's talking to you about what to look out for, let's say you have a wound and you're going home. We'll educate you and talk to you about it. If it's a new medication, I may say, Mr. Jones, this is a new medication. This is what it's for. I'll share with you the dosage, when to take it, and some side effects to look out for. And then to make sure that I did a good job of clearly communicating to you and that you're hearing what I'm saying and we're on the same page, I may say, Mr. Jones, can you just let me know how you're going to take your medicine tonight? The doctor may do the same thing. They may go over signs and symptoms to look out for infection and what you need to do when you need to call the office. And they may say to you, can you just tell me what were the things that you would look out for? What would make you call the office? That's techniques that we use. But what I want to really talk to you today about is you taking charge of your health and asking important questions at the visit so that you know exactly what you need to do and that you have a clear understanding of how you need to manage your health. So let's talk about why it's important for you to take charge of your health. You may say, I really don't feel like I need to do this. Isn't that the doctor's job? Isn't that the nurse's job? Well, it is shown that if you, as a patient, or if you're a loved one of a patient that goes to appointments with your loved one, take charge and ask important questions and have a clear understanding of what you need to do, you're going to be able to better take care of yourself. Knowing what you need to do is going to help reduce your risk of errors. I've seen quite a few patients in my career that have been admitted to the hospital because they may not have taken the right medication, or they took too much of a medication, or maybe they missed doses of a medication because they didn't understand the specifics about it. Another reason it's important to take charge of your health is because you really know your body best. You are the best one that know what feels right, what doesn't feel right, and what would be abnormal to report to your doctor. It's also important to take charge of your health so that you can have a say in the health care you want. You should let your voice be known so that you can share what your preferences are, what your values are, and what's important to you. Again, if you take charge of your health and have a clear understanding of what you need to do, it's going to help you get well sooner and be better able to manage your health condition. So today, I'm going to talk to you about 3 simple questions. It's called the Ask Me 3, and it's a way for you to take charge of your health. And the Ask Me 3, more information is available in the Institute for Health Improvement, but it's a program that was designed that suggests using 3 very simple, straightforward questions when talking to your doctor or nurse practitioner, pharmacist, any healthcare provider. And here are the 3 questions. What is my main problem? What do I need to do? Why is it important for me to do this? So you may say, why are these questions important? Why do I need to ask them? So again, this is going to make a clear communication to make sure that you have a clear understanding of what the provider has told you. You might be in a 15 to 20-minute office visit, or you might be getting a phone call from your doctor to give you some test reports and giving you some next steps. And asking these 3 questions, what's my main problem? What do I need to do? Why is it important for me to do this? Is going to help you better understand your health. And most importantly, in my opinion, act on that health information. You're going to know whether it's a new medication, how you need to take it, maybe a specific diet, foods to avoid, what would prompt you to call your healthcare provider. You're going to have those answers and know what you need to do after that visit when you ask these questions. It's going to, as I said, help you take care of yourself. So when should you ask these 3 questions? So as I said, pretty much any time you're talking to a healthcare provider. It may be a doctor, your nurse practitioner, physician assistant, nurse at the office, pharmacist, maybe your therapist that's coming by at the house. At your office visit, it's a great time to ask it when they get to the end of the appointment. You can kind of wrap it up, and when you're leaving, know exactly what you need to do. With the COVID pandemic that we've all been facing, I know that a lot of people are new to the telehealth appointments and having phone call appointments or maybe video appointments at your home. These are also great times to ask these questions. If a doctor, again, calls you to give you results of a test and says, we need to start you on this new medication, great time to ask these questions. Another good time is when you're preparing for a test or procedure, and you're going to get specifics on how you can prepare. Again, I've seen quite a few times in my career, patients miss a test or it gets delayed a few days because they just didn't have a clear understanding of maybe what meds they needed to skip before the procedure, or how soon they needed to stop eating before the procedure. So when you're preparing for a test or procedure, it's a great time to, again, ask these questions. We talked about medications, and I cannot highlight it enough that whenever you're prescribed a new medication, it's really, really important that you know exactly why you're taking this medication, how to take it, and then what are some side effects that you would want to report to the doctor. So again, great time to ask the questions. So, like I said, pretty much every interaction with a healthcare provider gives you the opportunity. So, you might ask, so I ask these questions, and I still don't understand what they're telling me. They're speaking in a language that I don't really understand. So, I encourage you to not just ask once. If you still don't understand, you need to speak up. And that's where that take charge of your health comes in. You may say, this is new to me. Will you please explain that to me one more time? But again, I encourage you, don't be nervous. The healthcare team, the doctors, nurses, pharmacists, we're here to help you. And we want you to clearly understand what you need to do. So if you need to ask a second time or a third time, it's okay. So again, write these questions down, have them available at your next appointment, whether it's via the phone or you're going into the office. What is my main problem? What do I need to do? Why is it important for me to do this? Don't feel nervous about asking the questions. Many people don't understand healthcare information or the care that they need. It's actually quite common. So again, that's why it's really important to ask these questions. So our platform's unable to show this video today, but I want to encourage you. It's a really great video. It's through the Institute for Health Improvement, and it's available on YouTube. This slide deck presentation will be available in about 2 days, and you can click on the link. But you could go out to youtube.com today after the presentation and just type in Ask Me 3, and this same video will show up. And it's less than 5 minutes, won't take much of your time, but I'm a visual person, and I think that they do a great job of showing you how this would look in practice. So I encourage you to go out and take a listen and watch this video. So we've been talking about taking charge of your health and asking the right questions. And I also think that it's really important as we're talking about taking charge of your health that we consider the time period we're in. And we're all a little nervous, a little anxious during this COVID-19 pandemic. But what I really want you to understand is that the University of Maryland Medical System hospitals, we're here for you. And we've implemented procedures and protocols to make sure that patients, family members, and staff are safe. So it's safe to seek care at the hospital. If you have an emergency or if you have elective procedures, routine care screenings such as mammogram and colonoscopies, I would recommend that you do not delay. You need to seek care. Delaying care may cause complications and long-term health problems. And talking about taking charge of your health, anytime that you are experiencing chest pains, trouble breathing, or high fever, or any other symptom of a serious illness, including heart attack or stroke, please call 911 or go to the emergency department right away. It's important for you to take charge of your health, whether it's an emergency, routine care. Do not delay, even during this pandemic. We're here for you, and you need to take care of yourself. So in closing, just remember the 3 questions that we talked about. What is my main problem? What do I need to do? Why is it important for me to do this? I appreciate your time, and I look forward to questions.
Mandy, thank you very much. As we move to questions, I note that there is one, someone asked to have the link for the video posted, so that's just been done. You can find it there. And again, let me reiterate that in 2 days, you'll be able to hear this entire presentation and see these slides online. I'll tell you about that in just a few minutes. There are a couple of questions that have come in, Mandy, if you don't mind. And one says, the internet is usually the first place that I go when I have a question. How do you feel about that? And if it's okay, what are the best sources of information that I can look to?
Sure, that's a great question, and I think something that almost all of us are quick to pick up our phone or go to the internet and start Google searching symptoms or how to take care of a certain disease. And I would highly recommend, if you're going to go to the internet, to make sure you're going to a credible site. There is lots of information out there, some really, really good and credible, and some that are going to steer you in the wrong path. So such sites as medical systems, they post webinars and education where government sites such as the CDC are great places to find information. But I want to stress wherever you go to get that information, and please be a credible site, that you would talk about that with your healthcare provider or your primary care provider, because the information you get is not individualized to you, and you need to know that what you're reading will work for you. So thanks for that question.
Sure. Let me remind, or maybe some of you joined us after we started. If you have questions, go ahead and post them in the Q&A box, and we'll try to get to them. Mandy, you mentioned a minute ago accessing care during the pandemic, and that apparently struck a chord. Someone wrote, "I'm concerned about accessing care at a hospital right now because I understand the visitor policies have changed because of coronavirus. Can I take a family member with me at all?"
Sure, that is a great question and very important to you. First of all, very important, what I said before, don't delay. Even if when visitor restrictions are in place, you really need to take care of yourself and get the care you need. I will tell you right now, at the University of Maryland Medical System hospitals, we have put in place restrictions to make sure that all patients and family and our staff are protected. But that being said, currently the policy is that in most departments that you can have one visitor with you per day, so that would make you feel better. But it's really important, and wherever you go, whatever facility that you go to access care, that you would just confirm that. But again, just do not delay. I know that it's kind of a different time and a scary time, but it's really important for you to take care of yourself. So thank you.
I'm glad that you mentioned confirming what the hospital policy might be, because would you say it's fair to say that as the science changes and as the circumstances change in our communities, the policies are changing as well?
Absolutely. Regularly, daily, weekly, absolutely.
All right, thank you. Another question here. Ask Me 3 sounds like a great program. Are healthcare providers familiar with it?
Oh, another great question. So I will say that many of our healthcare providers, teams, are familiar with the Ask Me 3 and are definitely familiar with different ways to communicate so that we can make sure you have a clear understanding on what you need to do. But if you happen to ask these questions and a healthcare provider hasn't been familiar with the Ask Me 3 concept, again, I encourage you not to be nervous. It's okay. Most of us that are in the healthcare field, whether we're doctors or nurses, therapists, we're here to help you, and we want you to have a clear understanding. So even if they haven't had exposure, which I think many of them have, it'll be okay. They will be happy to answer your questions and give you the right direction on what you need to do to take care of yourself.
There's a comment related to Ask Me 3 that I'll just share, which says, this Ask Me 3 is simple and straightforward, so even an elderly patient will be able to follow. Says, I'll be using these techniques this afternoon, so thank you for this timely information.
Fantastic. I love it.
I think that's great. Another question here says, I've tried in the past to get my doctor, not a University of Maryland doctor, to explain things to me in a way that I can understand, and it didn't work. He used words that I'd never heard of, and he made me feel silly. It made me not want to go to the doctor. What should I have done? What should I do?
So we always encourage you to speak up. Don't be scared. Don't be nervous. This is about taking charge of your health, empowering you so that you have the answers. So the example that I gave earlier, you can say something like, this is really new to me. I don't really understand. Can you please explain it again? You may want to bring somebody with you to your next appointment that could help take notes and, again, ask those questions to give you a little bit of a buddy support system. But always speak up. Don't be nervous or scared. You want to have the right information when you leave your appointment.
And Mandy, would you also say that it's really important that patients do establish a relationship with their physician, and maybe not everyone is not always the right match for you? You may want to think about who you see.
Donna, that is an excellent point. And it's really important that you feel like when you go to an appointment, you can share intimate details, that you can share your concerns, and you are validated. So absolutely, primary care provider you should have a great open communication line, and they should be meeting your needs. So if you're continually having issues with that, I would recommend that you find somebody that fits with your personality style and is meeting your needs.
Okay, great. And I have what I think is one last question here, and it says, I have a serious medical problem. It's really complex, and I often don't understand what I'm told. Can I take notes? Should I take someone with me? What's the best thing you would recommend that I do?
Perfect. Great. Another great question. So definitely take notes if you're able to. If you take a sheet of paper and, have these questions ready, you can kind of jot down exactly what those important items are that you need to do. I would encourage you, I always encourage patients when they're being transitioned from the hospital to home, especially those that have complex conditions, a lot of medications, need quite a few follow-up appointments, and need help, to have a support system with you, whether that's family, friend, whoever you feel most comfortable with. It's really, you only retain so much, and that's why it's important to write the information down. But when you have a second person there that's going to support you and help you, I would highly recommend that. That's a great thing that's a great person to bring with you to all your healthcare appointments.
Yeah, I have found that sometimes you may, especially when it's a hard diagnosis or it's complicated or you're nervous and you're afraid, and it happens to us all the time, you may not be able to absorb the information as it's coming at you, but somebody objective who can sit with you and also take notes can really help you later understand what's been said.
Yep.
Yeah. Mandy, this has been great, a great deal of useful information. We certainly appreciate it. I want to remind everyone that this webinar can be viewed in about 48 hours at the link that you see there, which is ums.org/letstalk. And again, say that the video that we weren't able to play for whatever reason today will also be available there. The link for that is posted in the Q&A. If someone would like to go there now, you can see it. And also, the University of Maryland Medical System, a couple of years ago, did a video ourselves about Ask Me 3, and we'll try to post that there as well, so you'll have more than one source. But if you go to the web, as Mandy has suggested, there's a great deal of information that will be available to you that you can avail yourself of. But the important part is to establish a meaningful relationship with your provider and to be sure that you understand the information that you're given when it's given, and that it comes to you in a way that you can really understand to keep yourself well or to help improve your health. And it's your prerogative to try to take charge of your health. It's about you, and get the messages that you need and make sure you understand that information. Mandy, thank you so much for sharing, especially given your background and the time that you've spent in this profession. We truly appreciate it. And everyone, thank you. Join us next month for our next community conversation. If you received information today already by email, we will make sure that you are kept up to date as to what we're doing each and every month. Thank you all for joining us today. So it's posted there. Next month will be on August 19th. It'll be children's health and children's safety, certainly a very relevant topic right now, summertime, but also given the pandemic. Thank you all for joining us today, and hopefully we'll see you again next month.